Well, there's no immediate issues there, looking at your health check, but I'm just wondering if there's a way that we can help you manage things a little better. Yeah?
Like what?
Well, have you ever tracked your diet yourself? Marked, kind of your exercise, number of steps that you're doing, drink, mood?
Well, yeah, funny you should say that. I've actually got a stepper, so I do try and keep have a certain amount of steps per day.
Yeah, good.
You mentioned mood. My kids got me this mood app for my birthday, which kind of charts kind of how you're feeling and stuff like that, but I don't use it as regularly as I might do. So
yeah, I mean that's often the way when you've got lots of different apps and different devices. So I just want to tell you about the NHS App Store. We've got an app for the smartphone which actually combines all of these things. So it saves you a lot of time. And what it'll do is it'll give you a far more sort of holistic and accurate view of your health now and how to manage your health in the future.
Oh, okay.
That's something you'd be interested in?
Yeah, tell me a bit more.
Okay, so what we do is, along with the app, there's a bracelet, a bit like the one you have there, but this one, or whichever colour you choose, so you can choose one of those. You put that on, and that monitors your vital signs, so, heart rate, pulse, how many steps you're doing, any other sort of exercise. You will then input your diet and what kind of other exercise activities you've done and your drink, how much you have to drink, upload that to the app, and that will give you a health score for where you're at now, and it'll give you an ideal range for where you need to be and what you need to stay within to have a healthy future.
I see, so it just kind of guides me each day if I need to do more or less of something.
Yeah, absolutely. But then there's also another benefit, which is if you choose to share that information, then it will contribute to a general research project that we're running across the NHS, which is about the future health of the country.
So who would I be sharing it with?
Well, you'll be sharing it with the NHS, hospital and so forth.
Oh, okay.
But with that, as we're piloting it at the moment, you will get a couple of other advantages, which is it'll guarantee you and your family as patients here at the health centre. And should you have to go to A&E at all, it'll get you to priority, really front of the queue.
Wow. Gosh, that sounds amazing.
Yeah, so it's a bit like private, but it is NHS if you choose to share your personal details.
Okay. So, well, I mean, if it's going to help me to, focus on what's going on when I'm not feeling brilliant all the time, then no, it sounds like a brilliant idea. Are you listening?
Sorry.
Look, so I've got the bracelet,
Right.
okay? It connects to this, and then I put all of my information in there. It then gives me a score, and then it just gives me like an idea of what I need to do the next day to like improve my health. Yeah?
Okay, such as what?
Well, like what I eat, how much exercise I'm taking, how much alcohol I'm drinking.
Alcohol?
My information.
Your information?
Which I will put in. And
You're putting it all online?
Well, yeah, because then, what was the thing I was talking about, whether or not I would be sharing that with them, which I think is a good idea. Once I share the information with them, it means that we're like at the top of the queue. Like if we go to a hospital, we are definitely guaranteed to stay at the GP practice that we're at, rather than, because I know there was threats of some people having to move on.
Yeah.
So, I just think it's great, don't you?
It sounds like a good idea, yeah.
And it's like really, like it combines so many different things. Rather, do you remember I had all the different apps for different things? Whereas this is
that combines all in one.
Yeah, it's all in one. I think it's brilliant. Look, it's got it's a nice little bracelet, isn't it? And it's got all that information. Look, it even tracks my heart rate and all of those things. I just think it's great. Don't you?
Well, if you feel good about having all that information out there, I mean, give it a go.
So, and I'll give it a try. If it's working for me, then maybe you, the kids, could get involved.
Yeah, possibly. Yeah, let's see how you go. It might even help with your work and stuff, mightn't it?
Yeah,
Work-life balance and all
definitely. Because you log that as well, how many hours you spent at work. It's brilliant.
That's a lot of information. Wow.
Yeah, I think it's really good.
Ah.
Oh, so you've given up, Aisha? What have you got there, Aisha?
Then she's got one of those future app things, you know, for her health.
Oh, I've got that. How are you finding it?
But it is really good actually, because you can connect it to your wristband, and it tracks like your blood pressure and your sugar levels, and you can input your BMI and things, and then you get this like score depending on what you put in, and you can have competitions with your mates. And obviously I'm losing, but it's still good.
Not sure I'd want to do all that.
Why?
I don't know, I'm just not convinced. I just don't trust the people with my data. I just think they'll use it and sell it on or something.
No, it's good to know actually. She convinced me. Look, got one that matches.
Oh, wow.
I use it for my managing my health and everything, but the only thing is that I just wouldn't use it to sort of like tell them exactly what I'm eating and when, etc. That's just between me and it.
So do you share your stuff?
Yeah, definitely. It's not anything that I wouldn't share like with my doctor or on Facebook anyway, so it doesn't really matter to me. But there are so many benefits. When Phil broke his arm, do you remember, Mum?
Yeah.
We got him straight to the top of the queue in A&E
that's
just
really
because
good.
I had the Apple Watch.
Yeah.
Oh, well, I'm going to give it a go.
Yeah.
Really? Yeah. I think it's going to be good.
Wow, okay.
Join the modern world, Sam.
Oh. I'm happy where I am, thanks. I'll stay in tradition.
Are you still here, Eva?
Yeah, I'm just finishing some stuff up.
You all right?
Yeah, good.
Oh, well, don't work too hard. I'll see you tomorrow.
Thanks.
Time for an update.
Oh, you're here. Oh, great. She's all right. She's okay. The nurse has just come out, so she's going to be fine. Okay. They're going to X-ray her. They're processing her now, but the administrator would like to see you first. Just through there.
Okay, I'll see.
Right. Yeah.
Just talk me through it. Oh, would you like to get that for me, Michael? Thank you. Hello, Mrs. Sargent. Do come in, take a seat. Thank you, Michael. I'll take it from here. Thank you. Hello there. Michael has updated me. Your daughter is comfortable. We're going to get a process through A&E as quickly as we can. Get her home, which I know is what you and your husband want. Okay, so don't worry on that score. I just need to go through a couple of things with you on the My Future Health app. Obviously, we have seen a couple of dips in the data for the past couple of weeks.
Right, but you just said that's not going to affect how quickly she goes through.
No, no, absolutely not. Don't worry on that score. What I'd like to find out, if possible, is what sort of things are you finding challenging, how we can help you if any way we can. Mm-hmm. Obviously, we do appreciate it's a big lifestyle change for you. Mm-hmm. So we do recognise that there will be peaks and troughs in the data as it comes through, quantity and quality.
Yeah.
So we just want to be able to see what sort of things you're finding challenging.
Well, work has been quite stressful this week, so I've had a couple of days when I know the data I'm putting in is not going to make my health score look good, but obviously you asked for truth, so that's what I've been doing, and I've put in days when I've not ate as well, worked particularly long hours and maybe had more alcohol than I should have done.
But at least you're putting that data in, and you are being honest, so we can actually see a full data capture for you, which is good.
What has been useful is, even though it has, you've seen that the score's gone down, it has made me more aware the next day of what I need to do to bring that score back up, so it's been useful.
Sure, thank you. That's really good.